What are hives? Hives are raised red bumps, welts, or splotches on the skin. They're a type of swelling on the surface of your skin that happens when your body has an allergic reaction. Allergic reactions happen when your immune system comes in contact with an allergen. Allergens are proteins that are harmless to many people, but cause an allergic reaction in sensitive people. Hives are often very itchy, but you might also feel burning or stinging. They can be as small as a fingertip or as big as a dinner plate. The medical name for hives is urticaria. Sometimes the welts from hives join together to form larger areas called plaques. Hives tend to fade within 24 hours, although they may be noticeable for several days or longer. What are the symptoms of acute hives? Hives look different depending on the person and the situation. They can show up anywhere on your body. Signs of acute hives include 1. Raised welts or bumps on your skin. 1. The bumps may look reddish on lighter colored skin. 2. Hives blanche. The center of the hive becomes pale when pressed. 3. Itchy skin. 4. Swelling under your skin causing puffiness, angioedema. 5. Also appearing with painful swelling of your lips, eyes, and inside your throat. What are the symptoms of chronic hives? In many respects, chronic hives and acute hives may look alike. They can be itchy, swollen raised welts that turn lighter in the center and with pressure. However, chronic hives can 1. Shift sizes and shapes. 2. They appear, disappear, and then reappear at least every few days for long periods of time, even months or years. 3. Happen along with heat, exercise, or stress. Causes of acute hives. Acute hives are often an allergic reaction to something you put into your body like food, drink, medication, or something you touch. The skin has immune cells called mast cells. When these cells go into action, they release chemicals, including histamine. Hives form due to histamine, but they can also occur for a variety of other reasons, such as an infection, stress, or physical pressure on the skin. It's not uncommon for healthcare providers to be unable to determine exactly what caused your hives. Causes of chronic hives. Unlike acute hives, chronic hives aren't usually caused by allergies. They may be caused by infections from bacteria or viruses, or by other medical conditions like lupus. Your provider may not discover an exact cause. In these cases, chronic hives are said to be idiopathic or spontaneous. Chronic hives can last for long periods of time, but are usually not permanent. They can be uncomfortable, but they aren't life-threatening. How stress affects the body. Your skin is an organ that detects when the body is stressed and reacts to stress. The exact reason stress causes a rash is unclear, but the nervous and immune systems play a role. The nervous system reacts to stress, physical or emotional, by releasing a hormone called cortisol that triggers a fight or flight response. Elevated cortisol levels lead to increased inflammation, excess sebum, and oil production in the skin. This can cause hives and other skin issues such as acne. When presented with an allergen, the immune system releases a chemical called histamine, anything your body might recognize as a foreign substance. This causes an allergic reaction. Histamine can also be released in response to stress. Research on hives and stress. Yes, you can get hives from stress. Several studies have shown a connection between stress and the development of hives, also known as urticaria. 1. Adrenergic urticaria. A study identified a new form of stress-induced hives called adrenergic urticaria. 1. This condition is triggered by stress and involves an increase in plasma noradrenaline and adrenaline concentrations. 1. Propranolol, a beta-adrenoreceptor blocker, can prevent this type of urticaria. 2. Chronic idiopathic urticaria, CIU. Research has shown that adults with CIU who experience higher levels of stress and anxiety may have altered HPA, hypothalamic pituitary adrenal, axis responses, which can increase the risk of sustained dermal inflammation and exacerbate hives. 3. Chronic spontaneous urticaria, CSU. Another study found that stress perception and resilience are linked to disease severity in CSU patients. 3. High stress levels can worsen the condition, creating a vicious cycle of stress-induced disease exacerbation. 4. Mind-body connection. Clinicians are increasingly recognizing the psychosocial precipitants of chronic urticaria, acknowledging that stress can indeed trigger hives. 5. Personal experience. An author living with chronic hives since 2016 noted that doctors have consistently suggested focusing on reducing stress to manage the condition, highlighting the practical recognition of stress as a contributing factor to hives. These findings collectively support the notion that stress can indeed cause or exacerbate hives. Managing stress to prevent hives. Stress rash is not always preventable, but identifying your triggers and managing your stresses can help decrease the frequency and intensity of your symptoms. Practice coping strategies. You may be able to prevent a stress rash by learning strategies to help you cope with stress. For example, if your job or family life is causing a lot of stress, schedule some time for yourself and engage in relaxing activities or hobbies you enjoy. If you're experiencing emotional stress, it can help to talk to a therapist or someone you trust about what you're feeling and how you can manage the situation. Identify and avoid triggers. Your triggers could be internal or external. Stress can come from emotional experiences or high-pressure situations, but it can also come from the environment. Extreme temperatures, noise, crowds, and poor air quality are examples of environmental stress. Recognizing and taking steps to avoid or manage these triggers can help prevent stress-related symptoms. 1. Don't neglect your skin. 1. Take care of it even if you're tired or stressed. 2. Get regular exercise. 2. It's good for your skin and the rest of your body. 3. Take time for yourself to do something you enjoy even if you only have 10 minutes. 3. Take a bath or read a book. 4. Take a walk around the block. 5. Practice stress management techniques like breathing exercises, yoga, meditation, or visual imagery. 6. Get enough sleep. 6. 7 to 8 hours each night is ideal. 7. Say no. 7. It's okay to set limits and boundaries to lower your stress. 8. Talk to someone. 8. Seek support from a friend or a professional therapist. When to see a doctor. While hives often resolve on their own, you should seek medical attention if you experience any of the following. 1. Hives that persist for more than a few days without improvement. 2. Severe itching or discomfort that interferes with daily activities or sleep. 3. Swelling in your throat, lips, or tongue that causes difficulty breathing or swallowing. This could be a sign of a serious allergic reaction called anaphylaxis, which requires immediate medical attention. 4. Hives accompanied by fever, joint pain, or other symptoms of illness. 5. Chronic hives that come and go over an extended period, 6 weeks or more. A healthcare provider can help determine the cause of your hives and recommend appropriate treatment, which may include antihistamines, corticosteroids, or other medications. Additionally, if stress is identified as a trigger, a doctor can guide you in managing stress effectively. Conclusion. Stress can indeed cause or exacerbate hives, a condition known as stress-induced urticaria. Understanding this connection is crucial for managing and preventing hives effectively. By recognizing your stress triggers and implementing strategies to manage stress, you can reduce the frequency and severity of hives. If you experience persistent or severe symptoms, seeking medical advice is essential to ensure proper diagnosis and treatment. Managing stress is beneficial for your skin and overall well-being, making it a vital component of maintaining good health. GTPS wverywellhealth.com, stress rash, 5 font 2700848.